Perfect. All right, guys. So welcome to our first virtual info session and career fair. My name is Kim. I am the recruiter here at St. Joseph's Hospital. Over the next hour or so, you're going to hear from myself as well as members of our leadership team and our benefit specialists to go over our open roles, our culture, why we love working here, and the benefits that we provide to you as well. We're going to start off hearing from our member in education to discuss our residency program. She's going to be coming on shortly, and then we'll go from there through a few different departments. At the end of this, we'll answer some questions. There is a chat feature in this live session that you can put in questions or comments, and we'll have some time at the end to go over those as well. We have many opportunities here at St. Joseph's Hospital, not only clinically, but non-clinically as well. We do have our School of Nursing that is attached to our hospital, an organization that provides us with different roles that you can get certifications and degrees in, as well as tuition deferment being accessible to you for those roles as well. I'm happy to answer any questions. At the end, I will also go over how to apply with a QR code and a link and my contact information to help answer questions about different opportunities for you. At the very end of this, if you want to ask any questions, we'll be happy to answer, and my number will be there for you as well. There is a slideshow here, more just as a visual to go over anything, and hopefully we'll have Diane joining us in just a second to go over the Vizient program. In just a second, she coming on? Okay. The Vizient program here is our new grad nationally accredited program for anybody coming into the organization as a new graduate RN that is available through the entire organization for new grads in all of our departments. On the inpatient setting, we'll just give her a second to get on. Hey, Diane.
Hi.
How are you?
I'm doing all right, Kim.
Good. Thanks for joining us. So just want to spend a few minutes here just going over the residency program, what it offers, what it's about, and just some details for us.
Yeah, so the residency program is for all of our new grad nurses. They're automatically enrolled in it after they've applied to St. Joe's. And what it does is it allows for our residents to have a year worth of time to get accumulated to and acclimated to their job. They meet with us once a month for 12 months for an entire shift, so for an 8-hour period. And then what they do from there is they also get at least 12 weeks on average of orientation. We take their orientation time on the floor, which is completely separate from their residency time. And when they're on the floor, they get matched up with a preceptor. They get about an average, like I said, of 12 weeks. We really try to customize our orientation time to the needs of the individual. So they'll be, we check in with them frequently. All the educators, there's several educators that are assigned to each floor. And then from there, the residency program, at the end of 12 months, they'll graduate, and we have a graduation ceremony for them. This also is involved with what we call the prep program. So their new grads are automatically enrolled in the prep program when they arrive to us. The prep program is a stepping program, like a ladder program for nurses to climb up. And when they arrive to us, they are a level 1. After they graduate from the residency program, they go to a level 2 and then can actually start climbing up the clinical ladder from there. Our residency program covers everything that they may encounter as a nurse. So for example, one of our first clinicals, we cover the hanging of blood and all things IV. We also have a lot of speakers come and talk with us. This would include our chief nursing officer. We have the director of pharmacy come in. We have case management come in. We've had employee experience come in. We've had our missions come in, infection prevention, and kind of give a layout of a global perspective for our new grads of how the hospital is. In addition to that, we really encourage our new grads to have a a step into our hospital and be invested in their work. So every new grad gets involved in an evidence-based practice project. And it doesn't need to be a big project, but it's just trying to make our environment and our atmosphere and our care more patient-focused with better patient outcomes through evidence-based data. So, for example, one of our new grads this time, they are in the emergency department and they noticed that they needed more barcode scanners. So what they did is they worked with pharmacy and they were able to accommodate more scanners for their staff. And we've actually seen some of our numbers come up for the scanning. So they were able to track the data and show that through our evidence that what they're doing is better for patient outcomes. Another thing about the Vizient program is it's a time for our new grads to start networking with other new grads and to actually have a chance to talk with and understand that there are other people that are, going through some of the same challenges that they're going through, and to kind of brainstorm and understand like what works, what doesn't work, maybe help each other out, reach out to each other. We've actually had several new grads that have graduated our residency program tell us that they wish that this would continue on after they stop because they loved the socialization of it as well. The residency program is definitely something that we're very proud of here. It is an accredited program, which means that it has accreditation behind it to prove that it is evidence-based itself. With that, we also have a grant for a virtual simulation program that's going to be acclimated into our next residency cohort. We've had the residency program here now for several years, and we were very fortunate to be able to be awarded this grant to have this virtual simulation program to incorporate that as well, just because it is another aspect that we're trying to understand if this is another way that we can help our new grads succeed. We want to have our new grads succeed. That is our ultimate goal. We also understand that being a new grad has its challenges, and we want to help them overcome those challenges and have a good work expectations, a good work experience, and to be the strongest nurses that they can be.
Excellent. That's great, Diane. Well, thank you. I appreciate you hopping on here quickly for us. A great overview of the residency program, and hopefully we'll have some people interested.
Perfect. If there's any other questions, let me know.
All right. Thank you.
Thank you.
All right. So as we go through here, it looks like next up we are going to speak with Kristen Billings. She is the nurse manager for our inpatient oncology department here. So we're just going to get her up and running, and we can discuss things with her. Hey, Kristen.
Hello.
How are you?
Good. How are you?
Good, thank you. Thanks for hopping on. So just kind of chat with us a little bit, about your department itself, what it's like there, what for culture, why you love working there, those sorts of things. Certainly, if you have open positions as well, we can discuss those too.
Sure. So our department is a little bit unique. We are at the cancer center, but we also have our infusion suite attached all in the same area. So patients who are coming in to see our doctors, they come straight back to right in the same office for their treatments, which is nice. We also have palliative care within our department to help some of our patients handle some of their symptom management, any issues they might have during their treatment. And they are right here and readily available, which is awesome for our patients. And we also have our own nutritionist and social worker as well that helps those patients really kind of get through. They're all very responsive, and they're all here to help the patients and to ensure that they get the resources that they need. Something that I really like about being here is that there are so many resources for our patients. I feel like the hospital as a whole goes above and beyond for patients. There's always something we can do to help them, whether it's financial support, emotional support, or anything that they could need, especially those that are going through cancer treatment, because it can be a lot. It can be a significant financial burden and emotional burden on not just the patients, but their families as well. So we're a little bit unique where we really all band together to make sure that the patients are getting what they need all the time. Currently in our department, we have an LPN position open for our clinic side. So they're in charge of prepping for the providers, rooming their patients, prior authorizations, some triage calls, and then we have a patient service representative for the front office as well. Both of those are currently open that we are actively recruiting for.
Okay, great. Thank you for that. I'm certainly happy to kind of get some candidates over to you. Thank you for kind of giving a good overview of your department, what you're looking for, and what resources they're able to provide to your very vulnerable patient population. So I really appreciate your time. And thank you again. Hopefully we'll see you on the next one.
Thank you.
All right, so it looks like we are waiting for a couple people to join here. That's okay. We may have a couple other departments. Oh, we've got Beth from the acute inpatient rehab joining us now. Hey, Beth. Oh, well, I have to get you off of mute in a second, but that's okay. So Beth is the clinical nurse manager. There she is. We've got her.
Hi.
Hey, how are you?
I'm good. How are you?
I'm doing great. Thanks for joining us. Just want to go, have a quick little chat about your unit, what it offers to the patients, what your goals are there as culture with your team, what you like, how you like working here, those sorts of things.
Great. So I am the nurse manager on 4 South, which is an inpatient rehab facility. We are within St. Joseph Hospital, so we have a lot of resources at our disposal that our patients may or may not need, but it's nice to have them here. Our unit takes patients that require intensive form of medical rehabilitation, that they get 3 or more hours of therapy per day. Therapy includes occupational therapy that helps with improving the ability to perform daily tasks, physical therapy that helps improve mobility, reduce pain, and recover from injuries. We also have speech and language therapy that treats speech and swallowing disorders. Speech can improve communication ability, and they work with patients to safely consume foods and drinks. So if somebody were to have a stroke and they had difficulty swallowing, our speech language pathologists work with them to ensure that they can eat and drink safely. Our rehab is overseen by Dr. Zurcher, who is a DO. He's an osteopathic provider specializing in our rehab services here for 23 years. Patients come to us after an acute medical event that require medical care as well as therapy to improve their mobility, help with their normal activities of daily living, as well as managing their medical needs. Patients come to the acute rehab for many reasons. People don't realize that acute rehab is not necessarily a drug rehab. We are a physical rehab. So we have patients come after falls. Maybe they have Parkinson's. They may be deconditioned after coming to the hospital with a medical condition like a UTI, after a stroke, or spinal cord injuries, as well as many other reasons. Our top diagnoses are hip fractures and strokes. We also treat neurological, musculoskeletal, and orthopedic needs, from ankle fractures to cervical spinal injuries. Coming to an inpatient rehab as opposed to a skilled nursing facility allows for a more intense therapy early on to help restore both physical and cognitive abilities, with the goal of helping patients live as independently as possible once they get discharged. Our typical length of stay is about 11 days. We get referrals from inside of our own hospital, as well as Southern New Hampshire Medical Center, Leahy, CMC, Beth Israel, and other hospitals in the New Hampshire and Mass area. Our team consists of nursing, therapy. Respiratory therapy is also within the hospital, and they come and treat patients as needed. We have liaisons that help screen patients and take referrals. We have our own social worker who does discharge planning. We also have our providers, from nurse practitioners to doctors, as we all work together to get all of our patients the care that they need while they're here, as well as setting up any home services that they might need upon discharge, and referrals for alternate level of care facilities if they require additional care when they're discharged. We also have, like I said, all the hospital resources at our disposal. So if a patient needs dialysis, they can come here and we can provide hemodialysis within the hospital. We have many returning patients that come back because they enjoy our staff and our services. I perform leadership rounding and I speak with all of our patients as well as staff. And I hear time and again how wonderful our staff are and how they are dedicated to their jobs, each other, and our patients. The same reason is given to me by my staff, that they answer the same questions, that they enjoy coming to work to take care of our patient population. And what makes their day better is the family atmosphere of our unit. We really work well together and make sure that we take care of each other as well as our patients. So what is it like to work here? If you were to come in on a normal day on the inpatient rehab, we start our day with a huddle. Huddle is important as it goes over our current patients to include high fall risks, any critical lab values, current needs for our patients that might require testing or procedures, as well as any outpatient appointments. And then we update our staff about anything that's going on the floor, as well as things live within the hospital that may be coming out. After huddle, both the RNs and the LNAs receive report from the previous shift to ensure safe, accurate, continuous care for our patients. Once report is received, our staff round on their patients to meet them, assess them, and then we update their whiteboards with the staff assigned to them for the day. So the patients or families never guess who's going to have them. They have the names all listed for them. The therapy board is a big part of our floor. We have a big board that takes up a whole wall that shows us what patient is going to have what therapy at what time. So we have to pay close attention to that to make sure that we can coordinate together to make the day go easier. Day shift then begins with morning med pass and coordinating with therapy to ensure the patients get their necessary medications, as well as the 3 hours of therapy that I mentioned. We all work very well together, which is an important part of our care to ensure that our patients get what they need while they're here from all their caregivers. The first therapist that sees our patients writes down and provides the patients with their daily therapy schedule, so that they also know the plan for the day. Throughout the day, our staff, both the LNAs and RNs, round on our patients hourly to ensure that they have what they need to maintain a safe environment. 4 out of 5 days of week here during the week, Monday through Friday, we have team meetings with nursing, therapy, the doctor, our rehab director, and social worker to meet and discuss any barriers to discharge and any pertinent discharge needs to be addressed to ensure our patients have a safe discharge plan when they're ready to go. A tentative discharge date is planned at this time. And then throughout the day, we do different things with our patients. We are fun here. We try to do games and we dress up on holidays. Day shift tends to handle more of our discharges, while evenings handles more of the admissions. Our shifts range from 7 to 3 to 7 a.m. to 7 p.m. or 3 p.m. to 11 p.m., 11 p.m. to 7 a.m. And some people do 7 p.m. to 7 a.m. So we try to work together to make sure that everyone can have a good work-life balance. Each employee has a shift that works for them, and we make sure that our floor is covered to provide the patients with what they need to succeed. A lot of our staff have been here over 10 years, with our longest employee having been here for 55 years, which is amazing. I feel that our atmosphere here is what keeps our staff here and what brings in new staff. I can say I've been here almost 8 months, and I'm very happy with my transition here, and I feel that we have a great support system at St. Joe's. That's 4 South in a nutshell.
Thank you, Beth, for that. That was great, very in-depth, entertaining. I appreciate that. Really gives a good show as to kind of what a day in the life is going to look like. That's great to know. Thank you for your time, and certainly encourage any of your other coworkers to jump on the next one that we have.
Definitely. Thank you.
Thank you. All right, so next we will be hearing from the benefits specialist. So while we wait for her to be hopping on, I'm going to go over some, usual or typical questions that we get asked, myself in recruitment, from different candidates that we have coming in. One of the biggest one is really what are the typical roles that are available here. So we have roles throughout the organization, both outpatient and inpatient, clinical and non-clinical. What I mean by that is we do have, of course, nurse positions throughout the organization, all the way down to environmental service, interpreters, our mobile health clinic, every different modality we do have positions open for. here. Some of them are full-time, part-time, per diem options as well. Our shifts are different. Some of them can be 7 to 7, as Beth just mentioned. Sometimes they're an 8-hour shift during the evenings. Every different department's going to have a different ask for their shift. And again, we do encourage work-life balance. Our roles look like ICU for night shift. We have med-surg evenings and nights. Our progressive care unit also has evenings and nights open. Our rehab, we're currently looking for night shift. The emergency department, we have open roles or open shifts, completely days, evenings, and nights. Our outpatient practices, you're going to be seeing your typical Monday to Friday, no weekends, no holidays, your 8 to 5. We have a couple of extended hour positions in outpatient. You're going to look at an 8 to 12 p.m. shift on a Saturday, just to kind of cover those patients that may not be able to be seen during the week. We have a clinical resource nurse role in oncology as well. That's more of a Monday to Friday, 8 to 5 leadership and clinical role there. So just to kind of give a good overview of what's available for clinical and then non-clinical roles, you're looking at, again, environmental service, food service, interpreter service. You're seeing anything between days, evenings, and nights, as well as per diem options there. We have positions open in MRI, rad tech positions as well. There's definitely something for everybody. Qualifications, we get asked a lot as well as far as what is required for positions. Every position is going to be different. Most of our positions do require some sort of certification or license, as in an RN license or an MRI tech license as well. We do have positions that don't require a degree or don't require schooling of that nature. So there's something really for everybody here. Culture-wise, I think that speaks to a lot of what we want in our candidates that we're bringing in, that we do provide something really for everybody. There's education and growth also provided in departments, the ability to transfer departments as well. And then again, speaking to the School of Nursing, the ability to grow your skills with different education opportunities that are available. In regards to the benefits, we do get asked a lot about that as well. Amanda should be hopping on soon. We're going to go over those pretty in depth, but there's a lot that we offer to different candidates here throughout the hospital. You are able to get benefits as full-time and part-time employees in a per diem role. It's a little bit different, but again, we'll discuss those soon. In regards to, the support for employees' wellness and mental health, sometimes we do get asked this question as well for recruitment. We do have an EAP system or program that we do offer the ability, if you are struggling in any sort of way, just for extra resources. So again, that's an added benefit for our employees and our candidates that are looking to come join our team. Again, we live in, the Southern New Hampshire area, so you are close to the Massachusetts area. So if you like to get into the city, it's close there. But then also, further up north, you're looking at getting into the mountains, doing anything outdoorsy there. So you're kind of getting the best of both worlds. We did hear from Beth and speaking about the culture in her department and how patients and doctors are really seeing that the employees seem to really love their job here. And I think that speaks volumes to how we treat our employees. They're able to give back because they feel well taken care of. We do get asked, especially in a clinical setting, patient to staff ratio for different departments. You're looking at a ratio being different in every area, but acuity and patient staff safety are of the utmost importance in that nature. So we can definitely dive deep into that furthermore during an interview process in regards to the ratio, but just understand the safety is of the utmost importance. And our safety scores are at the top, at the highest level that they can be throughout the organization. Another top question that we have give me just a second here. The employee vaccination requirements. We do get asked this a lot. So in recruitment, we do encourage the conversation. We do not require the COVID vaccination here any longer. Per state requirements, the flu vaccine is required. The Business and Health Department will collect all of that during your onboarding. And we do provide flu clinics throughout flu season as well. Another top question going forward is about onboarding, kind of what that looks like. So when we go through the hiring process, we're going to get you started with a start date. We run those start dates every 2 weeks. Orientations mostly starting on a Monday, give or take holidays. It may start on a Tuesday. We will ask for references, a background check. You'll have a pre-employment physical done as well prior to your orientation. And then you'll have orientation done with human resources. And you will also be provided with a schedule from your department as well as clinical education, depending on what role you are in. You'll be provided with orientation, for example, as an RN, it's usually about 8 to 10 weeks. Anywhere down from being a shadow opportunity as in a patient companion. Another question that we get here from time to time is, do you have to be Catholic to work here? You do not. We are all inclusive. That's a big piece to our organization as well, is diversity and inclusion. So you do not have to be Catholic to work here and be part of our team. Let me grab another question for you. Mentoring. So when we speak about mentoring and your orientation, for a good example, when you are an RN, LPN, or LNA here, you'll be matched up with a preceptor, depending on the work environment that you're in or the job role that you're in. That will decide your orientation length of time, and you'll be matched up with that preceptor, hopefully in a married state, so that you are always with them, as well as being able to provide that mentorship when you're done orientation, so you're never on your own. If it's not a specific person, it will be your clinical resource nurse on that department, or education as well. We'll be able to provide that mentorship for you. And then really a big one is employee recognition. So we here at St. Joseph's Hospital obviously want to give back to the employees and really show our gratitude for that. Every month we do run a mission champion of the month, and they are recognized, and they are kind of voted into that from nominations from different coworkers and peers for really their work performance and their teamwork here. So they are recognized in our atrium. We do have a bit of a ceremony, so to speak, for them, as well as a little bit of a sweet treat. And I believe they may get free parking as well for that piece, and potentially a paid day off. So again, just being able to recognize everybody for their hard work here is really something that we really love to do. It really keeps our employees engaged and great for everybody and patients as well. Another question, support and in regards to employees with disabilities, we are able to, help in any sort of way that we can. We have our employee health team here for all of your needs. In that case, we would want to set you up with them and make sure that you have what you need to be able to do your job. Again, with the diversity and inclusion that we provide to our patients, we'll also provide that to our staff. Another question looks like we have any remote options. So I get asked this from time to time. Remote options are there depending on, again, the role that is kind of advertised. We don't have too many of them, most of them being, a hospital organization. They are inpatient. They are kind of at the bedside, but every once in a while we do get lucky and people are able to get even a hybrid role as well. Let me see if there's any other questions coming in, be able to answer those for you. In regards to the patient care and safety, so prioritizing patient care and safety, obviously that is a great initiative throughout all hospital organizations, patient safety. I know that recently we did just have a couple of our units that made it, I believe, an entire year without a hospital-acquired infection. I hope I'm saying that correctly, and I may not know the units, but they are med-surg, very inpatient units, very difficult to really obtain that. So congratulations on that. And it just shows how much patient care and safety are a big piece to the organization here. Quality and performance improvement is a department here as well. So they take part in making sure initiatives are followed, and safety, is a big measure for everybody here at the hospital. We also provide different dress codes for different different departments. So every different modality will have a different color of uniform. For example, RNs are a navy blue color. Patient companions can wear a red polo top with just professional bottoms. And then every other modality will have a different scrub color. We do have a wonderful cafeteria here. If people are interested in getting meals there, we have a salad bar. They're always coming up with different exciting meals around the holiday times as well. You'll see leadership handing out and being kind of hands-on in the kitchen with the kitchen staff for their holiday meals and handing out that to the employees. So that's another piece. And we do have a new market for staff that has the ability to get kind of pre-prepared food, refrigerated, frozen, any snacks. There's a Starbucks kind of automated coffee system up there that you're able to do. So that's another employee benefit for people. You just kind of swipe your badge up there and kind of get some snacks for your shift and keep you going. Let me see if there's any other questions that are coming in. We should be getting Amanda in here soon for benefits. I'm sorry, it's a bit of a delay, but that's all right. Any questions coming in from the chat at all? All right. We're going to take about a 5-minute break and then we'll be back. All right, so we are back. Just a couple seconds there just to get everything situated. Looks like we have Amanda joining us here for benefits. So happy to have you on.
Hello.
Thank you for joining us, Amanda. Just gonna, go over our benefits for, a handful of minutes. Anytime that you have, we appreciate just kind of the ins and outs of benefits, what that looks like, and, what we provide to staff here.
Well, we do have a great benefit package. I'd like to point out first that we have a childcare reimbursement program with the YMCA. Any YMCA in the area, we will reimburse you 50%, which is, and as you can imagine, that's very popular. We also have discount memberships at the YMCA. So while you drop your kids off for daycare, you can work out. We also, if you participate in our HMO and or our PPO, we have a program at St. Joe's in Covenant that if you use a St. Joseph's physician and facility, there is no copayment, no deductible, no coinsurance. So it simply would save a ton of money. You don't have to worry about paying any of the out-of-pocket expenses that you would incur on using any physician that we do have here. We have a great earned time program. It is an accrued-based program based on your job, your exempt status, and your years of service. And you would accrue a set amount biweekly. And as you get here, if you stay at the company, the amount of time you get, it does increase, and that is used for vacation, sick, and the 6 major holidays that we do celebrate. We also have supplemental life insurance that is available for purchase above and beyond what the company provides to you as a benefit eligible employee.
So far, they sound great.
They're not bad. I use them myself.
Yeah, they sound great. And then what's the enrollment process for candidates coming in?
There is an online portal that you would use. You're eligible day one, and you would enroll in your benefits right on the portal. We try to get to it on orientation day, and sometimes it depends on how many people. We don't quite get to that stage, but you do have step-by-step instructions. And if anybody needs extra help, they can just reach out to me, and we can arrange something.
Okay, very good. And this is Aetna insurance, correct?
Correct. Our dental is through MetLife, and our vision is through iMed.
Okay.
And we also have short-term disability programs, long-term disability. We have a pretty rich benefit package. Not pretty rich, we have a rich benefit package.
All right. Well, again, thank you. I certainly don't want to take up too much of your time. Thank you for letting everybody kind of meet you and go over bits and pieces of that benefits package. And I appreciate it.
Not a problem. Thank you, everybody.
All right. And just to go off of what Amanda did say as well, in addition to the benefits that we offer here, there are other benefits not associated with the benefit specialist herself. What I mean by that is sign-on bonuses that are available for different modalities. So we have sign-on bonuses for many of our departments, many of our different roles. Each one of them is going to be a bit different, and happy to discuss that individually during the pre-screen process prior to getting you in for an interview. We can kind of discuss that because they are going to be different and individualized. We offer tuition reimbursement here as well for part-time and full-time staff members. We also have a tuition deferment program through our School of Nursing. So you provide us with 3 years of full-time work after you graduate, and we will cover your tuition at our School of Nursing. So it's a huge benefit for people. There's a lot of different great things about working here. I appreciate Amanda stepping in. It looks like we do have a question in the chat from Lionel. Appreciate you throwing that in there. If you live in another state and we want to bring you in for an interview, do we do virtual? Absolutely. We hire people from out of state all the time, whether they're moving back to the New England area or they're relocating completely. We'll set you up with the manager for a Zoom interview. And typically we will also make offers. Some people will prefer to do a Zoom, and if they're still further interested, also set up something in person. Again, it's individualized, but happy to do that. Not a problem at all. For nursing, as long as your RN license is a compact license, we can hire you right away. If you're not a compact, you do need to obtain a New Hampshire RN license prior to starting here with us. So it looks like really that is all the questions that we had coming in. I do see we had a handful of people kind of watching. This is our first live session, so I think it went well. In regards to anything further, we do hope to do a handful more of these for different departments. We'll have different leaders coming in, and we'll kind of go over how to apply going forward. I do have a link that we'll show you shortly in a second here on the website, goes to our careers website, you will be able to see any position that's available. It will show you which department, which shift, the hours, and a job description as well. Happy to go over the job description with anybody during a pre-screen to kind of go over your qualifications, what we're looking for, and if you're going to be the best match for us and if we're going to be the best match for you. We also have a QR code that's here. If you are watching, you can scan that with your phone. That's going to bring you into the system as well, so you can apply for a position. As you see there, that's my contact information, email, and my direct phone number. Happy to answer questions. We can go over really anything, get you in contact with the right leader for the department. Interview process is pretty cut and dry. It's pretty easy for everybody. We will do a bit of a pre-screen, making sure that, again, we align with what you're looking for and vice versa, get you over to the manager and get you in for an interview. From there, if you are accepted or if they are wanting to offer you a position, recruitment will reach back out to you. We'll make that offer and we'll go from there. We'll get you situated with a start date and get you in to join the team. Ultimately, we want everybody to be, watching these. We'll do a couple more. Hopefully, we'll do them monthly. We'll have different members of the organization join them as well to discuss their departments. Thanks for participating today, and we'll see you next month.